We've talked before about obesity, but diabetes seems to be a big factor here. You wrote the paper on this. How bad is it?
Yes, okay, absolutely. I'm glad you've highlighted it. So I think really the big issue, which has been ignored for a very long time, is, of course, obesity is a problem. It's a major problem in this country. 1 in 4 people are obese, 60% of adults are overweight or obese. But really what's going on from a medical perspective, from a biological perspective, is that people who have conditions associated with excess body fat are more likely to develop type 2 diabetes, high blood pressure, heart disease, and it's even now linked to things like cancer and dementia. And the term that we use in medical speak to describe that is something called insulin resistance. Now, why that's important, Kate, and why that needs to be addressed more, in a more kind of robust way by the Prime Minister, is that even people who have a normal weight will suffer from conditions related to excess body fat. So, for example, only 1 in 3 people with a normal body mass index, according to data in America, and our data is probably quite similar, are metabolically healthy. And type 2 diabetes in people from BAME backgrounds does seem to affect them at much lower levels of what we call body weight, more related to abdominal obesity or excess body fat there. So what am I saying? I'm saying actually the real problem, the bigger elephant in the room, if you like, beyond obesity, is the fact that it's estimated that 80% of Brits, 80% of UK adults have excess body fat, a term called overfat, and that's what we should be focusing on. So everybody's really vulnerable to this. Now, what do we do about it? Well, we've discussed this before, and what the Prime Minister should be focusing on is really targeting the food industry and our consumption of ultra-processed food, which is now more than half of the British diet. And unfortunately, a couple of issues that I've been researching and been involved in looking at over a number of years. One is the fact that our dietary guidelines, which come through NHS England and Public Health England in particular, have been influenced, unfortunately, by the food industry, the very industries that are kind of selling us and promoting the foods that are causing the problem in the first place. So there needs to be a complete dissociation from companies that endorse and promote ultra-processed foods from Public Health England. And the current, just to give you a very basic example, the current Eat Well guide, which is supposed to represent a healthy, balanced diet, unfortunately has junk food on there. That has been exposed in the British Journal of Sports Medicine by obesity researcher Zoe Harcombe, who highlighted that most of the members, or a significant number of the members who made up that plate, were members of companies that are basically, promote fast food and junk food. So there's one big issue there. But actually, the more important issue, I think, is the fact that our food environment has become saturated with these sorts of foods that make, junk food the default option. Even hospitals, Kate, for example, have become a branding opportunity for the junk food industry. 75% of food purchased in hospitals is not healthy. So this affects the staff. It affects the fact that, it basically influences the weight and health of staff, and then affects their performance as well. So we're all really vulnerable to this, and I think the Prime Minister needs to really focus on making sure that we fix the food, and if we fix the food, we'll fix healthcare.
Dr. Malhotra, the one thing I was going to say after all of that, you've summed up everything that I was going to ask you, but with one thing, people would argue it's expensive to live a healthy life, isn't it? They say gym memberships are expensive, junk food compared to healthy food is cheap. How does the government and how do individuals address that? Okay,
it's a very good point. So I think the first thing to say is we can learn from history. We very effectively, in this country, tackled tobacco consumption. And over the last 3 to 4 decades, we have reduced our smoking prevalence from more than 50% of adults smoking, in the 60s and up to 1970, to now less than 20%. And the way that was done wasn't from educational personal responsibility specifically. It was tackling the availability, affordability, and the acceptability of cigarettes. So taxing cigarettes made them more expensive, public smoking bans, dissociation, banning cigarette advertising. We apply the same principles to junk food. So you're absolutely right. We need to make those sorts of foods more expensive by taxes. Sugar drink tax is one example, but we should apply that to ultra-processed food. Make healthy food more affordable. But yes, it is doable, certainly. You can follow a healthy diet in an affordable way, even now. But it's harder because of all the marketing and all the, the saturation of the food environment with all these sorts of foods. It does make it more difficult for people. So they need to be helped. the most vulnerable members of society from poorer backgrounds are also the people that are more vulnerable to conditions like type 2 diabetes and obesity. So it needs a sort of regulation, legislation type approach from the government if we're really going to curb this problem. But the good news is, you know, studies on individual patients and groups of people show that you can reverse these sort of markers of metabolic syndrome. You can even reverse type 2 diabetes. Many of my patients are able to do that within a few weeks of just changing diet. So if you scale that up on a population level, then you could see dramatic reductions in type 2 diabetes, heart disease, obesity within just a few years of regulatory changes, which need to be implemented by the government. Hopefully Boris Johnson, really this has been a wake-up call for him. I'm really pleased to learn that he's also, you know, previously he was suggesting that he was going to overturn the sugary drinks tax. He's now said that's not going to happen. So I think he's coming to terms with the fact that really, if we're going to combat this problem, if we're going to protect our NHS from another viral pandemic possibly in the future, we need to really curb the consumption of these foods with regulatory interventions.
Thanks for tuning in, guys. If you're watching on YouTube, you can see my subscribe button in the middle of the screen, and go to extratimemovie.com to see our fascinating new documentary on stopping and reversing heart disease.